So, good morning and good afternoon to everyone. Thank you for joining our event, The Sustainable and Inclusive Solutions for Air Quality and Climate Change, a virtual learning event for Southeast Asia. I am Dang Espita Casanova, Program Manager of Cleaner Asia, and I will be your host for the welcome and opening plenary. So, before we start, a few reminders for the event. Please be reminded that the whole event is recorded, both video and chat, and participants are requested to send their questions and comments via the Q&A and chat box. Facilitators and or resource speakers will respond via chat or live if time permits within the session. Interpretation function is also available. Please click the headset logo on the lower right-hand side of the screen and choose the relevant language. Please mute the original audio to hear the translation. If you are experiencing slow internet, click the HD button on the lower right hand of your screen and change to LD. So we would like to recognize the support from the Stockholm Environment Institute, the Swedish government, and the Integrated Program for Better Air Quality in Asia with support from the Ministry of Environment of Japan for making this event possible. So this event aims to build change-making coalitions of policymakers, practitioners, and communities committed to implement integrated solutions to air pollution, climate change, as well as social and gender inequality in Southeast Asia. We aim to provide stakeholders with knowledge and tools to translate integrated solutions into inclusive actions, and also with the evidence based to build policy support towards managing emissions from industries, as well as to provide opportunities to participate in implementing actions through low-cost nudges and citizen science good practice. We also aim to introduce tools and instruments to mobilize innovative finance for air quality and climate action, as well as tools to aid decision makings in program development. We also would like to introduce strategic communication approaches to build political support and enhance accountability for shared concerns, and throughout the event ensure that cross-cutting themes of gender equality, disability, and social inclusion are integrated in understanding issues and formulating solutions to address pollution and climate change. We hear everyone, and we have actually also organized a preparatory event for civil society and other stakeholders to with a resounding message that we should ensure that no one is left behind in formulating and implementing solutions to air quality and climate change. So without further ado, I would like to call on Mr. Bjarne Peterson, the Executive Director of Cleaner Asia. Bjarne has broad international experience, particularly in environmental issues and sustainable development, with a proven track record of achieving meaningful impact through strategic leadership, resource mobilization, and team building at all levels. He has taken Cleaner Asia through continuous growth regionally as well as in China and India. And with this, I would like to call on Bjarne. Bjarne, the floor is yours.
Thank you, Zhang. And ladies and gentlemen, colleagues, good morning, good afternoon, depending on where you are in the world. It's indeed a pleasure to see so many of you in this learning series. As Zhang mentioned, our overarching goal with this two-day interactive virtual event is really to build solutions to air pollution, climate change, addressing the profound issues of social and gender inequality in Southeast Asia. We all know that air pollution and climate change poses a serious threat to the health and well-being of Southeast Asia's population, but in particularly women, children, poor and disadvantaged groups. I just came back from COP26, and COP26, some criticize it, but it did actually inject significant momentum for a net zero world. The net zero initiatives that policymakers put forward can not only help mitigate climate change, but also bring air quality and health co-benefit. Highlighting these co-benefits can help raise the ambition of sustainable and inclusive air quality and climate actions, while also, of course, achieving sustainable development. Indeed, the air quality community at COP26 made it clear that we must and should address air pollution and climate change simultaneously and with an integrated approach to three things: accelerate climate and clean air action, protect public health, and finally, and as importantly, deliver more equitable and fair sustainable development, and stressing the equitable and fair sustainable development. Current policies, plans, and programs, as well as resource commitments on air quality and climate change across the regions, often have marginal considerations to people in the margins, often due to lack of space for civil society participation in planning and decision-making processes. We must act swiftly and scale to empower all segments of society with information, capacities, and spaces for meaningful participation, with an explicit focus on those affected but not heard. We need to redouble our effort to address the impacts of air and climate issues with inclusive solutions, with a focus specifically and especially on gender, youth, and marginalized groups, ensuring that they are represented at all levels of decision making. This virtual co-invention and learning event is designed to close these gaps and transform knowledge actually into inclusive, integrated, and implementable solutions. With that, I thank you all for participating. I hope you'll have some great days ahead of you. I hope you learn a lot. And back to Dang.
Thank you so much, Bjarne. So now I'd like to call on Mr. Niall O'Connor, the Center Director of the Stockholm Environment Institute Asia Center in Bangkok. Niall has over 20 years of environment and development experience and has worked in senior leadership and management roles in various organizations across Europe, Asia, and Africa. And in his current capacity as the center director, Niall leads a multicultural team of environmental and social science experts to develop practical solutions to bridge science and policy. Niall, the floor is yours.
Thank you very much, and good afternoon, everyone. It's great to be here from the Stockholm Environment Agency and to work with Clean Air Asia on this interesting event. It's also great to speak about the intersection of air quality and climate change. And we're very happy that with our support from the government of Sweden through the Strategic Collaboration Fund, we can be a partner in this journey. I think recently you heard that the UN Human Rights Council declared that access to clean environment was a fundamental human right. We know that good air quality is vital to human health, to our agriculture, and to functioning ecosystems. And yet we see increasing air pollution continues to have a big impact on our climate. So I think we know that air pollution poses a huge risk to our health, yet over the years, the quality of the air we breathe keeps deteriorating. With 65% of populations living in cities, the World Health Organization estimates that over 90% of us, because it's about us, breathe poor quality air. We have high levels of pollutants that penetrate into our lungs, into our cardiovascular systems, causing heart disease, lung disease, respiratory infections, and more. And this, is something we need to address for our own health. And in terms of economics, air pollution is costing about 220 billion annually in terms of health expenditures or lost labor issues. And yet, worse still, the official deaths from ambient air pollution, it's about 4.6 million annually. And this is almost twice what we've seen for the official COVID deaths around the world. So how come our response to poor air quality and climate is not as focused or as immediate as our global response to COVID? So I think there's a lot more that we need to be doing together. We also saw recently in the Climate and Clean Air Coalition UNEP Solutions report that SEI was partnered to, that we know there are available measures that can help reduce the exposure, particularly here in Asia, to over 1 billion people to PM 2.5 particles. And we can help avoid many premature deaths and other health impacts. But why aren't we acting, and why aren't we doing it fast enough? We know for many years air quality has been strongly linked to the SDG targets, especially on health and environmental sustainability. SDG 3 itself calls for the reduction in deaths and illness from air pollution. SDG 7 on clean energy, and SDG 11 to reduce the environmental impacts on cities. And how? By making cities more sustainable, we progressively improve air quality. I think we still have a long way to go before we achieve this. So at SEI, we believe that research should not only focus on adding valuable knowledge, but also create actual change. So we continue to support projects that involve the co-development of knowledge among citizens, as well as addressing specific differentiated vulnerabilities amongst populations. We have helped pioneer a tool called the Low Emissions Analysis Platform, or LEAP, which is a software system for integrating energy planning and climate change mitigation assessments. And this LEAP model, I think used in over 180 countries, helps to analyze air quality, calculate emissions, and support city and national level policy making. And it's really important that we support such decision making. We continue to support research topics that address a number of areas of air pollution. We use citizen science approaches to help engage people and make them aware of the issues that they're facing. And for example, we do creative methods such as street art, which has helped us to promote air pollution in one of our projects in Kenya. But alongside this, we provide evidence, science-based evidence of mitigation potentials that help motivate the business sector to reduce air pollutions and make a just transition to clean energy. So a lot of work is going on to support different sectors in addressing this problem. But we know that air pollution doesn't affect everyone equally. And thus, and hopefully we'll hear more of this from our colleague Ha later on, but we're looking at the effects of air pollution in the labour market. And from a gendered perspective, this seems to be one of the least known dimensions of the problem. So working with ILO and the IDRC, we're looking to understand the impacts of air pollution on the world of work across East and Southeast Asia. And hopefully through identifying evidence-based policy options to improve air quality and to improve kind of the impact of employment for people working in areas that are exposed to poor air quality. We also work with our ongoing partner here, Chulalongkorn University, for mapping and analysing national air policies, looking at what are the successes to share and what are the barriers to overcome. We're testing models and actions, and also reviewing the role of international agreements in supporting air quality. And these are challenging for all of us. So here today, we're really engaged with this event hosted by Clean Air Asia. We want to emphasize the need that we have to come together. We need to combine the actions in air quality and climate change, and we need to work as think tanks, along with advocacy and civil society, along with government, decision makers, and with the private sector to help invest in and implement these effective measures. So clearly there are many, many benefits of working together and of addressing the issues in a combined manner. So as we all know, and it's this time of year, unfortunately, again, where we're going to be affected by the annual transboundary haze issues. So this is not just a local problem, it's not just a regional problem, but it's a global problem. So we need to scale up our solutions. And here we hope that SEI, with all the colleagues and partners here, can use this event to have deeper and more meaningful conversations on how we can address the growing problem of air pollution across Asia. So I'm glad to be here. I'm excited to learn from all of you over the next few days. And I wish you all a very pleasant forum, but please do engage, do challenge, do support and enjoy this. But please, let's make a difference and bring about quality clean air for everybody. Thank you and enjoy the event today.
Thank you so much, Niall. And now we would hear from the Deputy Executive Director of Cleaner Asia, Attorney Glinda Bathan Baterina, on the indicators of air quality and climate change in the region, as well as the opportunities to strengthen the consideration of gender equality, human rights, and social inclusion in air quality and climate action. Over to you, Attorney Glinda.
Thank you very much, Dang, and good morning, good afternoon to everyone who are with us here. I have the privilege of sharing with you the some updates on the status of air quality and the status of air quality management and policy in the region. Now, let me just um, show my slide here. Okay, it's taking a bit of time. Okay, so I'd just like to check if you can see my slide down.
Yes, yes, Glenda. Please put in view, full screen view, please. Thank you.
Okay, um, got
Click
it.
view full screen.
Okay, there you go. So I'll start with this slide on the impacts of air pollution. We have here the maps of Southeast Asia showing the number of premature deaths that are attributable to ambient PM 2.5, ozone, and household air pollution. About 500,000 deaths caused by air pollution are actually found in Southeast Asia. So, this is a great burden to the countries, particularly with large populations, so including Indonesia, the Philippines, and Vietnam. And as you can see on the right-hand side of the slide, the death rates are not equally distributed among these Southeast Asian countries. What we find is that in countries where people are exposed to high air pollution from solid fuel combustion, they are the ones that bear a large burden of disease and morbidity and mortality from air pollution. Now, going a little bit deeper, we can see here from this slide that ambient PM 2.5 um, exposure of people to ambient PM 2.5 actually is responsible for 51% of deaths in Southeast Asia. But that's very closely followed by household air pollution at 47%, and ozone is at 2%. The worrying part of this scenario is that 3% of deaths are actually of newborns. So we truly really need to protect our children from the health impacts of air pollution. Now, just going deeper onto that message of the need to protect the children. So, children is a vulnerable group, as shown in this study by UNICEF in 2021, where of the compounding environmental risks that they are exposed to, air pollution is one of the most worrying, because in this slide, about 2 billion children are exposed to air pollution. But then add to that all of the other climate and environmental hazards they're exposed to. And uh, just also exploring what the relationship is of air pollution, climate, and children, we have in the same study by UNICEF the Children's Climate Risk Index, which shows that our region, the Southeast Asian region, has very high climate risk index for children, as they are more vulnerable to air pollution and climate change than adults. So UNICEF's study and risk index reveals that 1 billion children are at extremely high risk of the impacts of climate change. Now, even very, very early on in the decade, in 2013, the World Bank had already estimated the economic cost of air pollution. And this has been valued at trillions of US dollars in welfare losses. But if we look at the region of the East Asia and the Pacific and South Asia, these are the growing, where the growing countries and cities are found, about 7.5% of the GDP of these countries is the estimated impact of in terms of welfare losses due to air pollution in 2013. Now, uh, a new information from new studies show that black carbon, which is a short-lived climate pollutant, is 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 affecting and impacting our populations here in the region in Southeast Asia. About 88% of global black carbon emissions are actually from open biomass burning and residential fuel combustion, and that is in the regions of Asia, Africa, and Latin America. The contribution of East Asia and Southeast Asia and the Pacific is 2.3 million tons of black carbon. That is about 35% of global black carbon. And the major emission sources also include transportation in addition to open burning and household energy. So, as we can see, black carbon concentrations in the region, in about 14 Southeast Asian cities, are at 1.98 to 7.25 micrograms per normal cubic meter. And this is from a mapping done by Clean Air Asia. Now, methane, we have heard of methane and, of course, of the 105 countries that have pledged at COP26 to cut methane emissions by 30% by 2030. And this is truly phenomenal because, indeed, as we know, methane is one of the most potent greenhouse gases with 10 times more powerful than carbon dioxide at warming the atmosphere. And what's been seen is that since the 1980s, atmospheric concentration of methane is increasing faster now than at any time. And of course, in terms of the impacts of increased methane emissions, which result in global warming, by reducing this, hundreds of thousands of premature deaths and asthma related hospital visits are going to be reduced. Now, zooming in on the policies that are in place in our region to manage air pollution, we're happy to say that 7 out of 11 Southeast Asian countries have PM 2.5 national ambient air quality standards. And however, what we are seeing is that of these countries, the standards are still less stringent by about 2 to 5 times compared with the 2021 WHO air quality guidelines of 5 micrograms per normal cubic meter. And as of date, we know that several more countries in Asia and the Pacific need to put in place national ambient air quality standards. And I think that should be a priority for us all here working on air pollution issues. Now, because we see that urban areas or cities are, as we have heard, 90% of people living in urban areas actually breathe air that do not meet the health-based WHO guideline values. Therefore, the working with cities to strengthen their capacity in air quality management is key. And thus, this is one of the focus areas of Clean Air Asia. When we survey all of the more than 100 international academic articles and reports on Southeast Asia and the impacts of air pollution and human health, what we're seeing is that there are still large gaps in evidence on the impacts of air pollution on different age groups, on vulnerable and marginalized sectors, such as children, women, the poor, and other disadvantaged groups. And while there is an increasing number of organizations that are working on the dual issues of air pollution and climate change, gaps in research and action oriented programs on the socio-economic and the intersectional impacts of air pollution and climate change are really still need to be bridged. Now, here on my last slide, I just pose a few thoughts on what is in the future for us in terms of science and solutions, and what should we be working on. So, what is clear is that after many, many years of actions on ambient air pollution, management, and control, we still see the persistence of household air pollution and ambient air pollution. This means that to achieve real reductions in the impacts and the cost of air pollution will require more scaled and ambitious action among countries working alongside stakeholders from NGOs, academia, private sector, and the youth and other sectors of society. Now, apart from the high cost of air pollution, we are seeing disproportionate impacts on the marginalized segments of our population. And this is making both air pollution and climate change real threats to our shared and inclusive prosperity. By damaging our population's health, air pollution may have a lasting effect on economic productivity and may perpetuate existing inequalities if it remains unsolved. The approaches we need are all of government and all of society to harness the co-benefits that help raise our ambition of climate and clean air actions, which will help us achieve several of our sustainable development goals. Now, on this last point, to enable greater and more meaningful participation, vulnerable and marginalized sectors in our society need to be empowered with information, capacity strengthening, and spaces for meaningful participation. Their rights and their indigenous knowledge, skills, and experience are vital to the sustainability of actions and the collective ownership of these actions to these twin existential challenges of air quality and climate change. Thank you all for this opportunity to share thoughts and updates on air quality across the region. I wish you all productive discussions for the next 3 days. Back to you, Dang.
Thank you so much, Glinda, for that wonderful, wonderful presentation and for really underlining that collaboration among stakeholders across societal segments is key to really achieving our goals. So we will now hear from Dr. Jean Peralta, a regional consultant on environmental health of the WHO Regional Office for the Western Pacific. Dr. Peralta has 40 years of experience across 30 countries, working on environmental health programs with government, academe, the United Nations, and international finance institutions. She is a retired senior environment safeguard specialist from the Asian Development Bank and was a regional advisor on environmental health at the WHO, where she is currently a regional consultant. And for 25 years, Dr. Jean Peralta has been involved in health impact assessment in various development projects. So handing over the virtual stage to you, Dr. Peralta. Dr. Peralta, if you can unmute. Okay, I can see you now.
Okay, thank you. So, Tanmi, I will present. Okay, thank you. Good day, everyone. It is an honor and pleasure for me to be with you today to share some messages about the health impacts of air pollution and to introduce the new WHO Global Air Quality Guidelines, which was launched 2 months ago this year. I'm Jane Peralta from the Division of Healthy Populations and Environments from the Western Pacific, Regional Office of WHO based in Manila, Philippines. Next, please. This is a slide to remind everyone about the event held every year on every September 7, International Day of Clean Air for Blue Skies. And you might be hearing about this also later from other colleagues. And it was established by the UN resolution in 2019 at the 74th session of the UN General Assembly, where UNEP was asked to facilitate all events. And that started the Clean Air for All held in September 2020. This year, in 2021, the theme is Healthy Air, Healthy Planet, which emphasizes the correlation between human and planetary health, which is particularly relevant in the context of the ongoing COVID-19 pandemic. On September 22, the same month, the WHO Global Air Quality Guidelines was launched 15 years after the earlier guidelines, which is in 2005. The WHO DG, Dr. Tedros, and the European Regional Director, Dr. Hans Klug, launched the new guidelines on that important day. They're now available at the WHO website. Next, please. You have heard already some key facts and information about the health impacts of air pollution. And so this is another slide that will contribute to that knowledge. We all know that air pollution is a major environmental risk to health, and it is often referred to as the silent killer. Every year, around 7 million deaths are due to exposure from both outdoor and indoor air pollution. And estimates show that over 2 million are killed in the Southeast Asia region, over 2 million in the Western Pacific region, where we are from, nearly 1 million in the Africa region, about 500,000 in Eastern Mediterranean region, and about 500,000 in the European region, and more than 300,000 in the Americas. By reducing the air pollution levels, countries can reduce levels of stroke, heart disease, lung cancer, and both chronic and acute respiratory diseases, including asthma. Next, please. This is a good graphics from UNEP, the UN Environment, which shows that air pollution impacts social segments disproportionately, with emphasis on impacts on women, children, and marginalized groups without access to clean energy. So let's zero in on energy throughout these examples. There are disparities in air pollution exposure, especially in the low and middle income countries, where poor people breathe polluted air due to large scale and widespread urbanization and economic development that relied mainly on the burning of fossil fuels. So in 2019, more than 90% of the global population lived in areas where concentrations exceeded the 2005 WHO air quality guidelines for PM 2.5. Around 3 billion people rely on open stoves using wood, coal, charcoal, or animal dung for cooking and heating, since 1 in 5 people still lack access to modern electricity. Every year, close to 4 million people die prematurely, mostly women and children, from illness attributable to inefficient cooking practices. One can see that the energy sector is the dominant contributor to climate change, accounting for around 60% of total global greenhouse gas emissions. Next, please. I just want to point out here that WHO is in charge of monitoring 3 SDGs related to air quality. The indicators are related to SDG 3, mortality rate attributed to household and ambient air pollution. Indicator 7.1.2, the percentage of population with primary reliance on clean fuels and technology. And indicator 11.6.2, the annual mean levels of fine particulate matters. So these are all reported by WHO, and data are constantly being collected. Next, please. This during the launching of the global air quality guidelines, our Director General has some remarks that have been guiding us in all of these activities on air pollution. Dr. Tedros, our DG, stated that there is nothing more essential for life than air. And yet, because of air pollution, the simple act of breathing contributes to 7 million deaths a year. Almost everyone around the world is exposed to unhealthy levels of air pollution. Our past speakers have already emphasized this. Inhaling dirty air increases the risk of respiratory diseases like pneumonia, asthma, and chronic obstructive pulmonary disease, and increases the risk of severe COVID 19. It is also a major cause of other non communicable diseases like ischemic heart disease, stroke, and cancers. He emphasized that air pollution is a health threat in all countries, but especially for vulnerable groups in low and middle income countries with poor air quality due to rapid urbanization and economic development, um, due to cooking, heating, and lighting that caused air pollution. He said that this is not a job for the health sector alone. It requires an all of government and all of society approach to improve the governance of air quality, the monitoring of air pollution risk, and the engagement of all the economic sectors in reducing emissions. Finally, he urged all countries to put these air quality guidelines to use, to save lives, to support healthy communities, and help address the climate crisis. Next, please. This is a bit of a noisy slide, and apologies for this, but it shows the difference between the 2005 air quality guideline levels versus the 2021 short-term air quality guideline levels. You can see the dark colors are the new guidelines, and the yellow bar are the old guidelines. So one can see that some of the parameters, such as the fine particulates, for example, have been stricter. And you wonder why they were made so, despite the fact that the past air quality guidelines were also very difficult to achieve. While these guidelines are not legally binding, like all WHO guidelines, uh, these new guidelines are based on evidence and inform policymakers to guide legislation and policies in order to reduce the levels of air pollutants and decrease the burden of disease that results from exposure to air pollution. The action that we could do is that countries could develop their own national air quality standards that are regulatory requirements which can be monitored and enforced. As you know, the guideline development was very rigorous with a defined methodology implemented by a guideline development group. It was based on lots of evidence to obtain from 6 systematic reviews and considered more than 500 reputable scientific papers. I am honored to have been part of this steering group on behalf of WHO, of WIPRO, and I could tell you that there are lots of evidence, new evidence now, that shows that we need to focus more on more protective health guidelines, because of the evidence shown that there are more and more air pollution related illnesses, especially for children and pregnant women. The steps to meet the new guidelines will not only protect health, but also benefit global efforts to tackle climate change. There are current levels that can be brought down to the interim targets to help countries to continuously improve air quality. So we are not going to be looking at these numbers as the final values, but they're only to provide guidance for countries while using the interim targets. So there are six pollutants here where evidence has advanced the most on health effects from exposure. These classic pollutants, particulate matter, ozone, nitrogen dioxide, sulfur dioxide, and carbon monoxide, are both applicable to outdoor and indoor environments and are based on expert evaluation of current scientific evidence. There are interim targets that are recommended in 4 stages until the guideline levels can be achieved. And this particulate matter, for example, has been identified of particular importance, hence the lower guideline values. They can penetrate deep into the lungs, and the PM2.5 can even enter the bloodstream, primarily resulting in cardiovascular and respiratory impacts. In 2013, outdoor air pollution and particulate matter were classified as carcinogenic by WHO's International Agency for Research on Cancer. Particulate matter is primarily generated by fuel combustion in different sectors, including energy, transport, households, industry, and agriculture. Next, please. So there was a landmark resolution from WHO that was adopted at the 68th World Health Assembly in 2015 in Geneva. The proposal was developed in consideration that air pollution is the largest single environmental risk and the leading cause of disease and death globally. It is a risk factor for ischemic heart disease, stroke, chronic obstructive pulmonary disease, asthma, and cancer. Air pollution's negative effect on health brings an enormous economic burden. So WHO has um, 4 key pillars to implement this resolution. It started expanding the knowledge base, for example, updating the air quality guidelines. It has developed um, training modules for the health sector, which can also be used by the other sectors towards institutional capacity strengthening. It has developed global platform for air quality and health monitoring and reporting, especially on those SDGs that WHO is charged. It also had some regional forum established which convenes experts and policymakers on air pollution and health, including the most recently the high-level coalition on health and energy. Next, please. So we have been talking about the health impacts of air pollution and what are the solutions, what can be done. I think it is has been emphasized by the other speakers and also, I'm sure, by the other future speakers of this learning event that multi-sectoral action with various agencies beyond the health sector is needed, and that to reduce this air pollution, it requires cooperation of various sectors and stakeholders. One could see here that investments in energy, efficient power generation, and also investments to reduce generations from agricultural waste and also from households and building more public transportation can be in different sectors can be the solutions that collectively can address air pollution. The health sector is crucial in raising awareness, gathering evidence, advising people on how to mitigate impacts, and joining advocacy efforts. Next, please. This is my final slide. And this graphic, which is part of the graphics that was shown earlier, developed by our partner, the UN Environment, shows the examples of solutions in the energy sector. It has been shown that 1 in 5 people have no access to modern electricity. So it is our advocacy that universal access to electricity should be a high priority. We also need to invest in renewable energy, such as hydropower, geothermal, solar, wind, and biofuels, because this will be good for both the planet and its people. For existing or future power plants or buildings, we need to have policies to enable energy efficiency and energy savings because these are sound, low cost solutions. There are also some clean air measures targeting different sectors that can protect everyone from all levels of society. It has been shown here that many things can be undertaken outside of the health sector, such as here, the energy sector, which contributes to better health outcomes. And finally, if I could emphasize the urgent message from Dr. Tedros again on dealing with air pollution, this is not the job for the health sector alone. It requires an all of government and all of society approach to improve the governance of air quality, the monitoring of air pollution risk, and the engagement of all sectors in reducing emissions. Thank you. Thank you, and have a good day. You're muted.
So thank you so much, Dr. Peralta. And again, I have invited our participants to share their comments or questions in the chat so that you can as well provide more information to them via the chat boxes. And now I would like to call our last but definitely not the least speaker, Ms. Ha Nguyen, a research fellow of the Stockholm Environment Institute, to bring us deeper into the social dimensions of air pollution in the world of work. Ms. Ha, the floor is yours.
Thank you, Dang. Hi, hello everyone. I'm trying to share my screen now. Can you see my screen? Hello.
Working well, Ha. Thank you.
Okay, sorry. Hi everyone. Thank you so much for giving me the opportunity to present about the result of our desk-based research. It was conducted earlier this year on air pollution in the world of work. So for those who are not familiar with the term world of work, it is a favorite term used by ILO that indicates labor and employment, including paid and self-employment, short-term, part-time, seasonal. So domestic and child care work, mostly taken by women, are also a part of the world of work. Our research aims to assess the current state of knowledge of interlinkages between air pollution and the world of work in East Asian and Southeast Asian context. We look for four types of data source. Statistical data on source and level of exposure to labor market. We also review academic and grey literature on health, gender and social dimension of occupational exposure to air pollution, we review different types of policy, like policy on air pollution, public space, exposure in work to air pollution in workplace, and labor and social protection policy. We also search for non-governmental initiatives that address air pollution in the world of work. Since we don't have time to present the whole report, I'm going to highlight some key findings from gender and social equality perspective, drawing attention to a specific marginalized groups in labor market, and hopefully this will serve as food for thought for the next section. So this figure, as you can see, moving from child impact of health on children to adults. So these figures compare the years of life lost between women and men due to exposure to air pollution in the former workplace, which is figure 1, and to solid fuel in households, which is figure 2. So the data shows that health burden of air pollution was higher for male than female. Yeah. Surprise. And in country where a large share of labor force works in manufacturing and agriculture, such as Cambodia, Indonesia, Myanmar, Thailand, and Vietnam, there's a larger health burden due to occupational exposure to PM gaseous fumes compared to those countries whose economy is based on service industry. From the literature review, we found that there's a large body of research focuses on occupational health impact, such as cancer and mortality risk that you have heard about in the earlier presentation, impact on respiratory, cardiovascular, reproductive system, while there's much less research on mental health and other impacts, social impact of air pollution. So those health impact have very strong correlation with social status such as sex, class, age, education, migration, etc. Those are factors that determines the type of job and the role that men and women worker perform, hence their exposure to air pollution.
Sorry to interrupt. Your screen share stopped.
Oops. Have you?
Can you try again?
Okay. Is it working?
Not yet.
Okay, I can unshare and share again.
We can see it now.
Okay, good.
Just have to full screen. And there. Thank you.
Yeah. Okay. Where are we now? Okay. Next. Okay. So we don't find many studies that explore workers' perception and experience of air pollution. This suggests that the knowledge of impact of air pollution are largely framed by public health and medical discipline, while rather than the day-to-day experience of exposed group. We also found that study on gender and worker exposure tend to be biased towards women and their gender roles, such as cooking and caring, while overlooking men and the way in which gender identity, such as being men, determine exposure to different types and sites of air pollution. All right. So our review of air pollution policy show that in the majority of countries in Southeast Asia have legal framework specifically to air pollution. However, some low-income countries such as Cambodia, Laos, Myanmar remain least advanced in implementing pollution control measure, and they are still lack a comprehensive policy framework to facilitate this implementation. In public space policy, which primarily apply in urban context, the connection between air pollution and informal employment is regarded as a matter of access to physical space and facility. So those policies assumed that exposure of outdoor worker to air pollution can be solved by structural solutions such as traffic management, transport, building public transportation, reallocation of street vendor to different parts of the city. So this access approach to air pollution in urban context does not recognize exposure and impact of air pollution on informal sector, and those policies are not effective or do not effectively address the causes, the structural causes of air pollution. So, and also in our review of labor and social security policy, we found that not all kinds of air pollution, as you can see in figure 3, are equally regarded as occupational health risk, and also compensation for occupational disease caused by air pollution is not always guaranteed. Labor policy often target industrial and wage workers, overlooking informal workers exposed to different types of air pollution. In addition, informal workers have to shoulder the burden of medical care themselves because access to social security is granted through formal employment. Next, in the review of
Tanmia shared the screen because it stopped from your end. So can you just please let him know which slide you are?
Okay, I am on slide number 6, I think.
Yes, this is correct. Thank you.
Okay, that's fine. So we have identified 23 projects that aim to address air pollution in Southeast Asia and East Asia region. This figure, you see, figure 4, present that thematic intervention. Sorry, you cannot see it. But basically, these are technocratic solutions to air pollution control that overlook dimension of vulnerability in the world of work, such as worker exposure to air pollution, lack of access to healthcare, social and worker protection services. Actually, we are still in the previous slide. Can you go back to the previous slide? Yeah, just leave it for now. Right. And the main donor of those projects are global and development institutions such as Climate and Clean Air Coalition, World Bank, ADB, UN agency, bilateral development donors. They significantly affect how inequality are being addressed through the way they frame problem and solution for air pollution. And local and grassroots actors who have better contextual understanding of air pollution on and different impact on different social groups and individuals seem to have very limited access to those kind of funds at the country level. Next slide, please. Next slide, please. Okay, great. So to sum up, to address air pollution and at the same time promoting green jobs in the transition to green economy, energy transition, there are a few issues that we need to attend. Firstly, informal sector remain nearly invisible in research and policy agenda. we would suggest broadening the definition of occupational health to include, for example, home-based worker residing near polluting industrial site. Secondly, there are gender stereotypes in framing research around occupational exposure. For example, most of the research on gender and air pollution focuses on women's domestic duty and their exposure to cook stove air pollution, despite the data that you saw earlier show that men experience more years of life lost as the result of household air pollution. You can question that. Anyway, it is important to understand way in which men and women of different social status exposed to different types of pollution. Thirdly, physical impact has been emphasized in research as well as in health and safety legislation. We need to understand and address psychological impact of air pollution as well. Besides technical and physical measure to air pollution at the site of work, it's also important to address ambient air pollution, which has negative implication on outdoor workers, many of whom are in informal sector. Lastly, we found that there's limited publication on air pollution in the world of work in Southeast Asia country, particularly in Laos, Brunei, Indonesia, Myanmar, and Vietnam. Therefore, more research should be conducted in those countries and in Southeast Asia region as a whole. We come to my last slide. I think you still have the last slide, which show our team, those who have written this report. Thank you very much.
Thank you so much, Ha. And I think before we end the session, there are just a couple of questions in the chat box. And maybe we can deploy one of those to our speaker. So I can see here, particularly for Ha, you mentioned about the bias of data on women that and overlooks men. Could it be possible too that there is a lack of analysis on the gender relations between women and men in the world of work?
Yeah, there's definitely lacks of study on that have gender disaggregated data. What the figure that I show you come from the health burden. Global health burden database and the ILO, which we use gender disaggregated data. But data is just data. You may have question about the data. But in reality, when we look at literature, qualitative research, there's really a dearth of research that really look into and analyze gender and social inequality or dimension of air pollution. So yes, there's definitely there's a lot of work that need to be done here.
Thank you so much, Ha, for answering that. And I think one last question. Not sure if Dr. Jean can respond. Dr. Jean, checking if you're still there.
I'm still here.
Okay, thank you, Dr. Jean. So maybe we'd like to hear if you know of particular projects taken that are, for example, in the Western Pacific Regional Office of WIPRO, that involved like marginalized sectors of the society, and if you could share just a bit of an overview and maybe direct our participants to more information on a particular project that you know of.
Thank you. Thank you for the question. Very good question. I think for WHO, especially here in MIPRO, I think we have always been thinking about our support and activities that would cater to marginalized groups. We have this theme, reaching the unreached. That is one of the four pillars of our, for the future, vision for the future of our regional director. And we have various guidance and activities on the ground within the countries. For example, in Laos, Cambodia, Mongolia, Vietnam, Philippines, and the Pacific countries where healthcare facilities in the rural areas are being inspected, whether they have enough facilities to be climate resilient or whether they have enough water, sanitation facilities, whether there is enough hand hygiene in schools and also at the household level. So there's the consciousness, constant consciousness, to be thinking of this marginalized and sector of the society, especially in the rural areas. I hope I answered the question.
Thank you, Dr. Jean. Thanks so much. And now I think we are now very much equipped, of course, with the facts and figures, the research, and information on the different, science and solutions that we can take with us throughout the event, and looking into the different programs and actions that are sustainable and inclusive. And with this note, I would like to invite everyone to join the next session on translating integrated solutions into inclusive actions in Southeast Asia. This current session will be automatically closed, and all you have to do is to click the join session button. And we see you all there in a couple of minutes. Thank you, everyone, and thank you so much to our speakers and panelists for this session. And we'll see you in the next 2 minutes. Bye.